Genitals. Pelvic exam in women begin with inspection of the external genitalia, looking for lesions, ulcers, discharge, swelling, or skin changes. Lesions may indicate herpes, syphilis, or HPV-related warts. Swelling of the labia could suggest Bartholin gland cysts or abscesses. Use a speculum to visualize the cervix and vaginal walls. A healthy cervix is pink and smooth. Erythema, mucopurulent discharge, or friability, bleeds easily, may suggest cervicitis, often from chlamydia or gonorrhea. Cervical motion tenderness during bimanual exam is classic for pelvic inflammatory disease. Palpate the uterus and adnexa, ovaries, and fallopian tubes. A tender, enlarged uterus could be fibroids or adenomyosis. An adnexal mass may suggest ovarian cyst, ectopic pregnancy, or ovarian cancer. Genital exam in men. Inspect the penis for ulcers, discharge, phimosis, or lesions. Penile ulcers may indicate herpes or syphilis. Urethral discharge can suggest gonorrhea or chlamydia. Examine the scrotum and testes. Testicular swelling may be from hydrocele, varicocele, epididymitis, or testicular torsion. Testicular masses may indicate testicular cancer. Tenderness and inflammation of the epididymis is often infectious, while torsion is a surgical emergency. Palpate for inguinal hernias by asking the patient to cough while you feel the inguinal canal. A bulge or impulse may suggest direct or indirect hernia. Cache lower extremities. Begin with inspection for color, swelling, deformity, or asymmetry. Unilateral swelling could suggest deep vein thrombosis, DVT, especially if warm, red, and tender. Check for edema. Pitting edema that leaves a dent with pressure is often from heart failure, kidney disease, or venous insufficiency. Non-pitting edema may be from lymphedema or hypothyroidism. Palpate pulses at the femoral, popliteal, posterior tibial, and dorsalis pedis arteries. Weak or absent pulses suggest peripheral artery disease at. Use capillary refill on toes to assess perfusion. Test range of motion at the hip, knee, and ankle. Pain with movement could indicate arthritis, bursitis, or tendinitis. Check strength and sensation. Weakness may point to nerve injury, stroke, or muscular disease. Numbness or tingling in a dermatomal pattern could suggest radiculopathy, as seen in sciatica or disc herniation. Look for joint deformities, such as valgus, knock knee, or varus, bow leg, and assess for crepitus, which may indicate osteoarthritis. Check neurological exam. Start with mental status. Check for orientation to person, place, and time, and assess speech, memory, and concentration. Confusion may suggest delirium, dementia, or metabolic disturbance. Examine the cranial nerves, CNL, rarely tested unless there's head trauma or smell loss. CN2 vision, test visual acuity in fields. CN3, 4, 6 eye movements, test for nystagmus or ptosis. CNV facial sensation and jaw movement, assess for symmetry and strength. Facial expression, ask patient to smile, frown, check for facial palsy. CN8 hearing and balance, assess for hearing loss or vertigo. CNIX palate and gag, check for dysphagia or hoarseness. Shoulder shrug, test sternocleidomastoid and trapezius strength. Tongue, observe for tongue deviation or atrophy. Test motor strength in all limbs using resistance. Weakness may suggest peripheral nerve injury, myopathy, or CNS lesion. Assess muscle tone. Spasticity may suggest upper motor neuron lesion, and flaccidity, a lower motor neuron lesion. Check deep tendon reflexes, biceps, triceps, patellar, and Achilles. Hyperreflexia indicates central lesion, while hyporeflexia suggests peripheral neuropathy. Evaluate coordination with tests like finger to nose, heel to shin, and rapid alternating movements. Poor performance may indicate cerebellar disease. Test gait. Have the patient walk normally, on toes, on heels, and perform tandem gait. Ataxia, or wide-based unsteady gait, may suggest cerebellar dysfunction or alcohol intoxication. Finally, test sensation using light touch, pinprick, vibration, and proprioception. Loss of sensation in a specific pattern may point to nerve injury, spinal cord lesion, or diabetic neuropathy.